Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News and World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Monmouth Moms podcast. We are continuing our family healthcare series today with Hackensack Meridian Children's Health. Our guest today is from Hackensack Meridian Children's Health, Dr. Thomas Priolo, Medical Director of Child and Adolescent Consult Liaison Psychiatry at Hovnanian Children's Hospital at Jersey Shore University Medical Center, which, along with Joseph M. Sanzari Children's Hospital, is ranked number 1 in the state by U.S. News and World Report. With it being back to school time, we'll discuss behavioral health topics and tips for helping your child. Welcome back.
How are you?
How are you?
Good.
Thank
it's nice
you.
to be back.
Yes, thank you for coming back. We had a nice chat. I guess that was in the spring, or was that almost a year ago? I feel like
springtime.
It was springtime. Yeah, it was definitely
springtime,
this year.
Yep.
2025 has flown by, and I feel like every adult says that. They're like, "Where did the year go?" But it's true. When you came into the office today, we were kind of chatting about a lot of things, real estate and all kinds of things around Monmouth County. But I did bring up how, just curious about back to school and transitions and kids and stuff, because, you're going from, which like you described is kind of like a, less routine, right, in the summer, no matter what age your kids are, either they're littles or maybe they're in kindergarten and you're just kind of entertaining them all summer, right? Or you have teens that are kind of just in August you're like, okay, they really need to get back to school because they're on their phones or they have no structure or whatever, right? But at the same time, then now you go back into September and it's back to routine and a lot of different things, and it's a big shift for the family, yes. Right? Which can cause anxiety and all kinds of things in children. So we're going to cover a lot of questions that we have here today, back to school time, whether it's the first day or, now we're kind of into the second week, with the exception of Little Silver right now, because I believe they had some renovations in one of their schools. So a lot of the kids actually are delayed and are still not back to school. So they're still in summer mode. But for the most part, everyone in Monmouth County is back. And it can be challenging, as I mentioned. What are some things parents can keep an eye out for during this time, and what can they do to help, for kids that are perhaps struggling with the transition back to school?
Sure. So, as you said, the transition back is always a major event for these kids.
Sure.
I think in the days prior to school starting, getting them back to their normal bedtime routine, is where they have the correct hours of sleep, and kind of reminding them school is coming, life's going to change a little bit, keeping the conversation in a positive tone.
Yeah.
Setting their expectations for these changes to come. Once the school year starts, and as it already has, just making sure that they're continuing this routine, and they know that bedtime has now shifted because they have to wake up earlier, or giving them kind of their routine after school, whether it be homework or a snack after school, kind of reminding them things that they're going to do without necessarily nagging them. So just so they're comfortable, they know what the next day has in store for them.
Yeah. We were kind of guilty of that. I kept saying to my daughter, okay, and August 15th, okay, next week we're going to stop going to bed at 10, because she and I will stay up watching. Our thing is we watch Gilmore Girls at night, and we do our little, our shows and our routine. And, I was letting her stay up till 10, sometimes 10:30. She's 10, and, sleep until 8:30, 9 o'clock in the morning. And she goes to school early. She has to be there by 7:20 in the morning. It's early. So it's a big change. And then, of course, like it just snuck up on us on like Labor Day weekend. I'm like, get in bed.
Same story with us. We have a 5-year-old, and he'll usually go to bed 8:39. And in the week before school, we were making him go to bed early. And he's like, the sun is still up.
Yeah.
Why am I going to bed? And we had to explain to him, school's coming. You're going to need energy for school.
Yeah.
If you're tired, you get a little cranky. So,
yeah.
it was we tried to have this age appropriate conversation of like reasoning with him, in one ear and out the other.
Totally. Yeah.
But
they need sleep.
Yeah, they need sleep.
I read that like her age group, they need like at least minimum 9 hours of sleep. So, we try to meet that mark for sure. Well, when is it time to seek for professional help, and what to do when, like what services look like that, if kids are struggling for, a multitude of reasons, that maybe have anxiety due to back to school. I'm sure there's, some bullying incidents already, and just, all kinds of things that happen.
So I think this also should start to take place before the school year, really.
Okay.
Ensuring that you have follow-up with your doctor either in the weeks prior to school or the weeks, after school starts, follow up with your regular caring psychiatrist or therapist, whoever that is. Sometimes the pediatricians manage medications too.
Okay.
Just to make sure the medications are dialed in, or the therapy is kind of on track of where it needs to be.
Uh-huh.
The other side of it is once they start school, you want to make sure that the team at school know if there's any special accommodations, if they're on medications, ensuring that the school has the form filled out. This way the nurse can administer the medications in school. If there's an IEP or 504, you want to have those meetings early on in the school year to make sure all of their needs are being met.
Yeah.
Those are kind of like elementary, middle, high school aged kids where you want to be in close contact with the school. Ensuring that your kid knows who to go to in school, whether it be the school psychologist or counselor, introducing the two of them. This way they have a relationship to start the school year off. There's definitely been instances of bullying that we've seen in the emergency room, in the urgent cares, where children are having some difficulty with social interactions. I think for parents, the big thing is just to offer support, letting them know, it's not about you, it's more about the bully. Kind of guiding them towards these more positive relationships that they have.
Yeah. Twofold. One, perhaps you have a child that, has not seen a therapist before, is, not on medication, but maybe is just showing signs of being down, right? They're coming home from school, and maybe the kid that you knew last year who was like very happy and well adjusted is now, not that, right? And we were talking a little bit about middle school and kind of how, that sometimes can change with children because of all the things that they're faced with. What do you recommend in a situation like that where maybe you're just kind of not sure like how to handle it?
Sure. So I think it's important to understand the developmental level of these kids. The stressors of a elementary school kid might be a little different than a high school kid. So if you start to see mood changes or changes in their level of functioning, thinking about what kinds of stressors they might have. So for an elementary school kid, it might be the start of homework, or their friend groups are changing.
Yeah.
Maybe they're having difficulty in the lunchroom, the bus. Middle school, I think the social aspects start to be a little bit different. They're a little more mature, but at the same time, they have this immature need for acceptance between each other. And the stressors are kind of different. They're maybe being picked on for the way they look or the way they act, whereas elementary school kids, you don't see that as much.
Okay.
And then high school, I think, is a whole different ballgame. Whether they're starting high school or in high school, they have different schedules than the other, elementary or middle school. The friend groups are maturing a little bit, but at the same time, they have these, immature kind of, or not fully developed senses of self-esteem or outlooks on life. And you also have to worry about substances in high school.
Yeah.
So once you start seeing these changes in your child that you haven't seen before, it's important to think about where they're at and kind of understanding the possible stressors, sitting down with them and having an open, honest, non-judgmental conversation.
Yeah.
It's important for your child to be able to talk with you and not worry about getting in trouble. If you have a high schooler who might be experimenting with substances, it's better to know than not to know. So having this conversation, especially if they're struggling, having this very non-judgmental conversation where they're not going to face discipline necessarily.
Okay.
And having them open up to you about maybe they tried drinking or maybe they tried smoking. And then going over, why did you do that? Do you think it's a good idea or a bad idea? Understanding where they're at and meeting them there rather than expecting them to meet you where you're at.
Do you think that parents don't do that because they don't want their children to think that they are accepting of it?
I think parents sometimes are fearful that the children will think that. And that is definitely a concern. But at the same time, you want to know what they're doing.
Right.
So it doesn't mean you have to be their friend and accept that they're doing it. You can explain to them that it's not acceptable in your household and set your expectations of, being a good student and being a good person and all of that, while also understanding that at these ages, they're going to kind of be their own person.
Yeah.
So kind of, working both angles of being this supportive parent of understanding and then also from the other side, setting expectations and these rules. And then I think it's important when you're on that side of setting the expectations of rules, having an understanding with each other. So if your child is maybe doing something you don't want them to do, having kind of a negative reinforcement or a punishment that both of you agree on.
Yeah.
This way, when something happens, you're able to sit down with your child and say, listen, we said if this happened, then the next thing would happen. So let's say they did something they weren't supposed to do. You told them they weren't going to go out that weekend. This is already established. So then once that happens, you already have this established plan. And you're fair. It's not something that you're coming up with on the spot where maybe the child perceives it as unfair.
Yeah, right. Yeah. A lot of talk right now about mental health in children with phones, social media, just having access to all of it. So I had a call yesterday with a company who kind of tries to manage that and help parents navigate it. But there's a lot of different organizations coming out. One in particular in Little Silver that's trying to just spread awareness about, phones and what kids have access to and stuff like that. But I'd say most everyone will agree that kids being on social media, especially from a young age, can be very detrimental to their mental health. To anyone's mental health. I mean, I personally even, try to limit my time on social media. My family will probably roll their eyes with me saying that, but it's my job, right? A lot of it is just managing, campaigns, right? And making sure that things are working through, throughout social media. But I, have found that if you're on it a lot, you do sometimes have these negative, ugh, that's beautiful, I wish I could do that or whatever, right? So why wouldn't we, think that our kids are going to have the same reaction? So, my daughter does have a phone now, but she does not have access to any social media. And I've been very clear that is just not something that's going to happen anytime soon. And it's for her own good. And I explained very, very, just very open about why. And here's, we just don't want you to really feel like crap about yourself, because you're great and you're beautiful and you're this and you're that. And I don't want you on social media, thinking otherwise, and not only that, but just all of the things that happen on social media within their peer groups, right, too. So I think my question is are there going to be more, I guess, guidelines from the medical community from are you seeing more kind of mandated guidelines coming through from for different age groups, I guess, for access to phones and then social media in particular?
So the guidelines are kind of have been out for a little while in that they give a certain amount of hours, 2 hours on the phone
Okay.
of screen time. But I think in regards to social media, it's kind of like this very difficult battle because of the reasons that you said. We all love going on social media and scrolling and
Right.
kind of burning some
Right.
time on those apps. It's easy.
Yep.
How do you tell your kid not to do it when we're doing it?
Right. Right.
It's a really difficult conversation to have. I think the way you view it is perfect in that there's so many negative things, and there is an age appropriate time for each kid. It might be different, but there is an age appropriate time where they should have access to it. But until that point, they shouldn't. And I think that, like I said, it's different for each kid. But having that conversation of really pointing out the negatives is always a difficult one because the kids always focus on the positive sides of it, or feeling that their friends have access to it. Why can't they have access to it?
And there's a divide too, because some
Yes.
parents allow it and some don't. And then it's like, it's hard because it's like, okay, well, I'm not a person that I don't judge, anyone for, if that's fine with you, that's great. But like, here's our rules and whatever you do, I don't care. But I think it's challenging for parents right now because they have certain rules, and then like their kids might be friends with someone else that have completely, full access to all of it. And then you don't know like what they're, how they're using it, like when they're together. So that's tough. But I think, the mental health aspect of like kids being on social media and also the bullying aspect too, I think is huge too. Do you see a lot of that?
Yes. It's way different than when we grew up.
Yeah.
Because the bullying takes place at school and then will take place on social media.
Right.
And the kids that are being bullied just can't get away from it. And it's difficult for them to understand that kind of they're almost looking for it once they're being bullied. They're checking their phone to see if somebody said something about them.
Right.
And it's such a difficult thing to get these kids to kind of step back from that. It's really sad because the answer to it is, I don't know what the answer is.
Yeah.
Because they have access to the phone.
Right.
You could take away the phone, but they're the victim here.
Yeah,
so you don't want to take away the phone.
And it's like almost like a punishment for not.
Exactly.
Yeah, for not doing anything
so
wrong.
it's like you're stuck kind of in between a rock and a hard place.
Yeah. No, it's a lot to navigate, and I think as we continue to just like evolve, I was telling the story yesterday too about my son is 21, and he was the first generation of kids to get a smartphone. We didn't know any better. I had no idea, like just like Snapchat and all the things disappear, all of it. I'm like, wait, what is happening? Like we had now I know. But it was interesting to like kind of witness like as it's evolved, and now we have all of this, we remember what it's like to not have the internet. Like we're the only generation that remembers the last generation, I'd say. So it's just like an interesting perspective to have, right? Because like we know what the world was like before, and now the kids, they're just like look at you funny, like what, like
Exactly,
this is
yeah.
So
for my 5-year-old, it's he doesn't have social media obviously, but his friends go on their parents' phones and play games, and he's not allowed to do that.
Okay.
And when we're with our friends, he'll go on our friends' phones and play games with their kids.
Right.
And then when he comes home, he says, "Why can't I have that?"
Right.
And we just tell him those are the rules.
Right. Yeah.
At 5, it's a little bit of an easier conversation.
Yeah, they can just go play with something else.
Exactly.
Yeah, I know. Yeah, in 5 years, it might be a little more different.
It's going to be a different time.
Different for sure. Okay, so for children and teens who are already taking medication, under treatment, a switch to a new school with a new nurse and routine may cause some stress. So if they've moved, but also, kids that are in a district where it's a new school, right? Like they are maybe just, depending on the school, maybe it's 4th and 5th is a different school, so different routine. What can families do to ensure that there's a smooth transition there?
So the big thing for the medications is ensuring that the school has knowledge of the plan with the medications, what dose the medication is, when the kid gets the medication, possible side effects. If the kid gets it at the same time and he's in the same class, making sure that teacher knows that he or she has to go to the nurse at that time to get the medications. And also, it should go unsaid, but making sure the school is professional about it, and it's the child's medical information. So it doesn't have to be spoken about, or no other children have to know about it. I think there's been times where comments were made and kids felt uncomfortable. So kind of making sure everybody's professional around it, and also making sure the people who have to know about it. This way the kid gets their medications on time. For those that aren't on medications but still need additional help, as I said before, ensuring that they know who to go to, when to go to them. Sometimes you can even schedule like almost appointments with the school counselor, maybe once a week, where the kid can just go. If there's any problems he or she is having, they could go talk to the counselor about it. So ensuring that they have a good network and foundation at the beginning of the school year. This way, throughout the school year, it's already there.
Okay. Interesting. You brought up IEPs a little bit before, and I have a lot of experience with IEPs and having a child that like needs more resources within the classroom. That's an interesting thing to navigate. I did it for, I guess, about like 14 years or so, right? It's like, well, a little bit less than that. Maybe less than that, like 12 years of like IEPs and just kind of like navigating the classroom and each teacher and everything, with my son who had ADHD, and just like a real, it was kind of the same story every year, where like he really, he was a nice kid. We always find him looking out the window and like kind of not paying attention and stuff. And then having to kind of re-explain that every year to the teacher, like a new, if it was a new school, it was a new IEP team, right? Tried different medications over the years, and those really never worked. And then it ended up being fine, and he found his way, and it was fine. But really stressful during certain years, especially like the late middle school, early high school years were probably like the toughest, just like with like worrying about like him being on top of his grades, and just like they're not, some kids are like super like mature and really good at like staying on top of their things, and some kids are not. And, navigating that is tough. And I think, having that diagnosis, or any type of like, maybe a child who requires extra resources within the classroom is one thing, but then the like mental health, kind of component of it is also challenging, right? Because they, it's a confidence, level. It's a, just like having that constant, like, I need extra help, and like just always kind of like being down about it, and then not, perhaps not performing well, like not getting the grades that you want. So, and then the stress at home, right? Like of your, just this tension, right? So I'm sure you see a lot of that. What do you advise, do you advise that parents should, if they are in any type of situation like that, like should they be seeing a therapist on top of the treatment plan that they're maybe perhaps getting from their pediatrician, or like a medical professional?
So I think there's kind of different ways to go about this, and that's why I'm kind of pausing for a second. If the child has no history of anything, and it's something new popping up, there's different kinds of approaches to this. One of the approaches that I think is a really great approach that one of the doctors over at Jersey Shore has implemented, Dr. Mira Wells. It's the Pediatric Psychiatric Collaborative.
Okay.
And what this is for children who have no mental health resources at the moment.
Okay.
If they're going to their pediatrician, they're having difficulty. Their pediatrician maybe tried a medication, didn't work, or is hesitant to try medication because it's out of their comfort zone, right?
Yeah.
There's different kinds of medications, different uh, personalities of pediatricians. Some are more comfortable managing mental health medications. Some don't want to touch mental health medications. What the PPC is, the Pediatric Psychiatric Collaborative, is a state-funded program that many of the pediatricians in our state have access to. So they're kind of a consult service for the pediatricians. And there's different levels of consults. There's like a curbside consult where a pediatrician might call in and say, I have this kid, this is what's going on, what do you think we should do?
Okay.
Then there's more formal consults where the pediatrician says, I have this kid, I'm not really sure what to do, I want them to come and see you. So the family will go and see a psychiatrist for an evaluation. And then the psychiatrist is able to make recommendations from that evaluation. Sometimes it's suggesting or recommending medications to the pediatrician. And then the pediatrician will follow the recommendations and manage the medications on their own.
Okay.
Other times it might be the child needs therapy or a psychiatrist. And the PPC will arrange or accommodate these needs. They'll get appointments for the children. They can guide them to where they might be able to get the medications a little quicker if it's kind of more of an acute need. So it's a really nice service for these children who don't have any resources.
Okay.
Beyond that, I think it could be a little difficult finding child therapists, especially ones that take insurance. We have a really nice network where we have ample availability for medication management and therapy appointments for children. We have different levels of staff. We have psychologists, we have psychiatrists. All of them are able to do therapy.
Okay.
With the IEP and 504s, I think it's important to understand the difference for parents. The 504 is something that schools are, I think, more agreeable to as the first step. It's not something that, it's a little less formal. It's recommendations from the doctor or therapist that they feel the school can make these accommodations.
Yeah, the 504 plan.
504 plan, exactly.
And then the IEP is like the
IEP is something a little more formalized.
Right. Yeah.
The 504, the reason why schools are more agreeable to it at start is because there's no cost associated with it. There's no like formal testing. There's no child eval team.
There's no second teacher like required.
Exactly. It's much easier. And sometimes that's enough for these kids.
But they get like extra time.
Exactly.
Things
So
like that.
they can get extra time on exams. It can include things like bathroom breaks at specific times in the day, leaving class 5 minutes early, access to the nursing station if they're having anxiety or whatever it might be. Special seating in class or on the bus, things like this. That's what's kind of included in the 504 plan. Kind of like these easy adjustments in the day.
So the adjustments are good, but from as a parent, speaking as someone that we had both, the kids don't. It's nice that they have those accommodations, but don't always take advantage of them because they're embarrassed.
Yes, and with the 504, there's no responsibility to ensure that it's being followed,
and it's oftentimes not.
It's oftentimes
and
not.
The parents, it can be a nightmare for some parents. I didn't have a nightmare experience. I have to say, it was fine. It was good that we had it, that we could utilize it. But I know a lot of parents do really struggle with like
a lot of parents and the kids struggle with it. Oftentimes they come and say, a lot of times the parents will say the school's not following it. And then you get to the bottom of it. And like you said, it's because the kid doesn't want to leave the classroom 5 minutes early.
Or they don't want to say like that. I mean, they will, I think a lot of the time they'll take the extra time, like on the test and stuff like that. But that kind of is where it ends, where like you said, or, they don't like that if they have the IEP that they do have a second teacher in that class, or they're put into a class with an extra teacher, right? Where like, and then that is also like kind of just a different thing. So there's a lot of, I guess, like variables there. But like what I'm asking really is just, I think that there's just a whole mental health component that then becomes that because they're struggling, right? But then like it adds like a different layer of like just, like affects their self-esteem and their confidence levels and all of that.
Yeah, it definitely does. I think a lot of the times these kids in the classroom if there's a child with an IEP, there's an extra teacher in the classroom, most of the kids don't know who
Yeah.
the IEP is
Right.
for.
Mm-hmm.
So it's important to
Yeah.
remind
Yes.
the child of that, because that extra teacher will help kids even if they don't have an IEP.
Yep. Mm-hmm.
And, I was in high school classes where there was an extra resource teacher. I never knew who that was for.
Right.
And for the child that it's for, they may not like consciously be aware of that,
Mm-hmm.
but it's good to remind them of that. Like, just rely on them when you need, but
Right.
the teacher will walk around and kind of help whoever needs to be helped.
Mm-hmm. So do you recommend that, like, if, say, like my son was in 3rd grade when like a lot of this started, kind of like testing and stuff for all of it. And it was, I remember just being like kind of very like, oh my gosh, like it's new, right? He was my first child, and just like nervous about all of it, and managing. I think I probably was more nervous about it than he pretty much was. But it's a lot. So like, what do you recommend to parents to have them come talk to someone, or is it just kind of a case by case?
I think it's important for parents to rely on the services that they can get.
Okay.
Full-fledged. Just if the school or somebody feels that your child might need these extra services, accept it.
Okay.
And don't hinder your child's experience or education because of feelings that you might have. It's difficult.
Right.
My son's in speech, and we kind of we have similar feelings too. So you have to look inward a little and understand, like, it's good for them, so just do it.
Yep.
If you're having difficulty, I think it never hurts to talk to somebody. And that might even be the child's provider.
Yeah.
Having some time where just you talk to the child's provider, whether it be the therapist, the psychiatrist, the pediatrician, or somebody in the school, and explaining your reservations about it.
Yeah.
And just having this adult conversation without the child in the room.
Yeah.
It could help.
Right. And just advocate for your kids. I think it's just always so important. If something in your gut, just like,
Mm-hmm.
just keep asking for help. Okay. Kids that are moving away to school, I'm sure is, it's a different type of, it's something that you're like think is a ways away, and then all of a sudden they're at that age and they're going away to school. Do you find that a lot of kids struggle do they struggle more like before they're leaving, or like once they get there? It's like, do you start getting like a lot of phone calls?
College is a completely different experience, obviously, than the other schools.
Right.
From what I've seen, most of these kids, they choose where they want to go.
Mm-hmm.
So before they go, it's all excitement and
I'm going to Miami.
Exactly.
Right.
Some of them understand that there might be different feelings once it starts, but I think the general trend is that excitement.
Yeah.
Once they go, these stressors are completely different. So you really got to watch and make sure, kind of evaluate for homesickness.
Okay.
Make sure they're going to their classes and hanging out with the people they're hanging out with is like the crowd that you expect them to hang out with.
Mm-hmm.
I remember when I went to medical school, I went away, and there was a time I was in the car with my mom, and she says, "Nobody thinks you're going to go away because you're such a mama's boy." And I said, "I'm going. I know it was going to be hard, but I'm going."
Right.
And once I went, I was so homesick, and my mom would come visit me. And
where was it?
I went to Grenada.
Okay, where is that?
It's an island.
Oh, and okay,
Yeah.
got it. Okay.
So it's far
Yeah,
away.
okay.
It's like a 7-hour flight.
Right.
But we made it work. She came to, my parents and my girlfriend at the time, who's now my wife, would come down and visit. I would come home, kind of just making sure that support is there. Even these kids who maybe in high school were always out with their friends and really independent, we see them missing home and missing those meals that they had at home, or their friends at home, whatever it might be. And just checking in to see how they're doing. Mm-hmm. And asking what they need. Mm-hmm. Because sometimes you might think you know what they need, but you don't. So just asking those kids, how can we help as a parent? I think, and having that conversation is important.
Yeah. No, it's a big adjustment. I remember when I went away to school, and like you said, it's just, you're excited to go. And then once you're there, it's the reality of, you you have the cafeteria and stuff. You're not like you're not like just in an apartment, like, cooking your own meals, but it's a lot. And also, you're with a roommate. I roomed with my best friend from high school. So we knew each other, right? So it was fine, but it's still kind of an adjustment, right? To like live with someone that you've never lived with. And
you're going down to the cafeteria to eat.
Yeah.
When you said cafeteria, it was in my mind. Like,
yeah.
You don't go to the kitchen and eat. You got to go downstairs, cafeteria.
Yeah.
Shared bathrooms a lot of the time.
Yeah. Which is just like, yeah. But also, I will say, some of these dorms now, I don't know if you've seen just on social media, like people's, kids are posting. They're like apartments. It's insane. My dorm was like the size of this room. It's like
you could touch
no closet.
Touch your roommate's outstretched arms.
Some of them are really nice. So I'm like, wow, we've come a long way. But still, yeah, like, and I remember my first semester, I was like very, it was fine, but I didn't I probably became more of like a hermit in college, which is bizarre. Like, I didn't want to go to parties. Like, I just wanted to go to class and study. And like, I didn't want to go out much. And like, I didn't love where I ended up transferring, and that's a story for another day. But I didn't love where I went. So it was like in the middle of nowhere in Pennsylvania. And it was just not like, I don't know, it's a lot. So I think, what you're describing, for a lot of kids get there and they're like, oh,
Yeah, I had the same exact experience with college. I went away. It was just New York City. We lived in Central Jersey, and I would be home every weekend. I thought I was going to join a frat, and
Yeah, I came home
and I was like,
weekend
I
too.
can't do any of that. I got to go home.
Yeah. Yeah. I know. I did the same thing. We came home every weekend. I had my car there. I forget even how I had my car, but I ended up coming home. But everyone's experience is different, but can be challenging. So how can parents navigate care? If they are on medication, especially if they're out of state, how does that work?
A lot of the college campuses have some form of mental health staffing and support on campus.
Okay.
Ensuring that your previous psychiatrist talks to the psychiatrist there, kind of to provide some information, the medication regimen, expectations, kind of having that professional conversation is always nice. When you move to a different state, sometimes your psychiatrist that you were previously seeing won't be able to see you in this new state. So making sure that you have this access, because God forbid something happens, you're having a difficult time and you need somebody, you call your psychiatrist who you might have a good relationship with.
Yeah.
They're not really able to help.
Right.
So making sure that you have knowledge of where to go before any of this happens is important.
Okay.
Like I said, sometimes it's on campus. If it's not located on campus, there's a lot of the times psychiatrists who deal with college-age kids around the area. So just calling, seeing the doctors there, making sure it's somebody that you're a good fit with.
Yeah.
Kind of proactively.
Okay. One topic just came to mind as we're talking about campuses and mental health. And I think it's an important topic, and also probably something that maybe when it happens, we are all, saying different things. And as parents, it's really challenging to navigate, which is these school shootings that keep happening, right? In colleges now, obviously in elementary schools, and you're always just praying that it's not going to, be your school. The interesting thing about how I think we were also I was in high school. I think one of the first school shootings happened with Virginia Tech. I think I was in high school or maybe in college. I don't remember what year that was, but it was around that time. And my daughter's 10, and they have lockdown drills at her school. And I honestly I've never, I guess, maybe felt like she was old enough that I had to even talk to her about why they do that until this past 2 weeks ago, where the shooting unfortunately happened in Minnesota. And my daughter goes to a Catholic school, and I just kind of felt like it hit very close to home. Like I could have, it just I was like, wow, that could be anyone, that could have been us, and it's awful, it's heartbreaking, and you don't even know what to say. But I think that being a child in this world right now where things just seem scary, right? Yesterday there was also the shooting, and I think another school shooting in California. I talked to my daughter a little bit about it. I said, why do you think we have lockdown drills, and like what, how do you feel about it? And like what would you recommend like parents say? Like how do you talk to your kids, especially like age appropriately, and when, I don't think I ever even said anything before this because I didn't want to scare the crap out of her.
Mm-hmm.
It's like, hey, we have these lockdown drills. It's because of people, we're trying to prevent people coming in your school to harm you. I don't want her to have nightmares about it, but at the same time, it is a reality.
Yes.
So does this come up a lot, and what do you recommend for parents to say?
It's a terrible problem.
Yeah.
And I think it's a really difficult conversation to have. One that we shouldn't need to have.
Yeah.
But we do. I think the way you went about it is the correct way.
Mm-hmm.
As they're young, you don't want to invoke this fear that maybe will cause them undue stress.
Right.
But as they get older and kind of seeing the news and understanding the world that they live in,
yeah,
offering some advice and guidance on why they're doing these things
mm-hmm.
might quell the anxiety rather than, when they're younger, it might cause worsening anxiety.
Mm-hmm.
So kind of talking with them and really in, I think, not a provoking manner,
okay,
but just this is to help protect you.
Mm-hmm.
It's something that we need to do. It's a sad time, but having them understand that these drills are important. They're not a joke,
right?
And
To take them seriously.
Yeah, exactly.
Right.
And then answering their questions as honest as you can.
Mm-hmm.
I mean, you don't want to give details of school shooters to a 5-year-old,
right?
A 10, even maybe a 10-year-old, but letting them know that the world isn't a safe place
mm-hmm.
all the time, and this allows you to be as safe as you can in uncertain times,
right?
Kind of, in those kinds of words.
Yeah.
And then as they get older, I think just having open and honest conversations with them. A high school age kid might have these abstract questions about why these people do these things.
Right.
And just answering to the best of your ability.
Mm-hmm.
It's going to be an uncomfortable conversation for you and for the child.
Yeah.
But it's better for them to talk to you about it, talk to mom and dad about it, than Google it and see the information on the internet.
Well, yeah, because it's everywhere. And like you said, like it's horrible, but it's also unfortunately kind of mainstream,
Mm-hmm.
right? Where like it's just part of our reality, which is just crazy. And like it's, my mom texted me yesterday and she said, I'm just so sad that my niece and nephew and my daughter have to grow up in a world like this right now. And and it's just like, yeah. And it's part of you just wants to be like, yeah, but it's not, and like, you just want to like refocus and be like, but okay, let's not think about it. But she's not wrong. And like, it's very,
I had the same exact conversation, with the 2 shootings that happened yesterday. The school shooting was like barely covered.
yeah,
Because it's just, it happens.
yeah, I know.
It's such a heartbreaking thing.
Yeah, it is. Yeah. And like, like I said, it sometimes, not that it doesn't ever hit close to home, but I think maybe just like certain ones, right? It's just like, wow, like I it could have been, like that could have been me. And these poor parents, like I can't even imagine. But yeah, but the kids too, like we can at least like process it, we can like, it's sad and it's horrible, but for them, like I just don't even know how they feel. And I want to protect my kids and but also like make them understand that like it's a reality, which just sucks. So
Yeah, it's terrible.
So with that, we've covered so many different topics today, and there's a lot of different issues that the kids go through in today's world, which is unfortunate, but also the silver lining is that there are great resources available in our community through Hackensack, and one of which, we chatted about last time you were here, which is the behavioral urgent care.
Yes.
That is in Eatontown. And now Hackensack actually has more, but they're not, are they in Monmouth County or no?
So right now we're located in Neptune.
Okay.
Eatontown, Freehold,
Oh.
and Clark.
Oh, okay. Oh, okay. I'm misinformed. So there's 4 in Clark too.
Yes.
So that's incredible. And that happened pretty quickly in the last
Yes, it
year.
happened quickly.
Yeah.
Our goal is to continue the expansion.
Okay.
I think the nicest part about it is it's immediate access to care when you need it.
Mm-hmm.
There's some limitations in regards to prescribing like controlled substances there, but we see all different ages, from age 5, even younger, up
Wow.
to adults. We've seen 80-year-olds there, so it's available to anybody.
Mm-hmm.
You come, there's no wait. There's 2 physicians, 2 psychiatrists that are able to see patients, and the best part I think about it is we're able to get follow-up quickly.
Mm-hmm.
Our intake coordinator is great at Jersey Shore, and she kind of is in control of the southern region appointment. So most of the times we're able to have an appointment made within 2 weeks.
Oh, wow.
So it's been a really, really nice program for kids. We're only 4 days into the school year, and we've had a number of like school clearance letters where the school will send children in and they need to see a doc before they're able to go back to school.
Mm-hmm.
So it's nice for those kids because they're able to see us same day and get back to school the next day.
I see.
If it's appropriate.
Okay.
Other children we might need additional resources for before they're able to go back to school.
Mm-hmm.
But we're able to provide that, which is nice.
Yeah.
We see all different things. Sometimes a kid might just have a tough day at school and they need somebody to talk to.
Mm-hmm.
They come, we talk, provide some, of what we call crisis therapy, which is, sometimes supportive, motivational, interviewing, things like that, kind of pepping the kid up sometimes, whatever it needs. I think the families have really appreciated the service.
Yeah, because mental health resources, even 7 years ago were not as accessible as they are now, I'd say. When I first started Monmouth Moms, I used to actually remarked on how there were very few mental health practices that marketed themselves. Maybe like kind of the bigger ones did. Very hard to like access or navigate where to go, right? And as like I'm going into like our 8th year running this platform, I've seen a huge shift in, just new practices opening. Obviously, Hackensack is really invested in the growth, right, of mental health awareness and resources for families in our community. And I think that's great because when you're in like in a situation and you don't know where to turn, it's like you need something now, like that's where you go, which didn't
Mm-hmm.
exist, which is great. So I remember even growing up, like I had friends like that definitely could have benefited from that because their parents were just like, what do you do and where do you go? And you just went to the hospital, right?
Mm-hmm.
So I just think it's a great program that you're leading.
Yeah, it's really nice, like in between of like this outpatient appointment that you need to wait for and the
even
emergency
sometimes like a
room.
month, right?
Exactly.
Yeah.
And then the emergency room, you go there, it's hectic.
Right.
You're waiting hours to see somebody.
And maybe the ER doctor, might just they might not know exactly like how to
Mm-hmm.
handle that the particular situation, right? Like the way it should be. And,
Exactly.
and your team would.
So I really believe in this program because I think it's really helping kids. I see it every day, and it's really been a nice thing. And like you said, Hackensack is very focused on mental health and allowing the growth and kind of the different ideas the docs have, and they're fully supportive of the growing and the changes that we want to make. So it's really been a nice place to work. It's very supportive, as I said. So, hopefully we continue to kind of come up with ideas to meet these needs.
Yeah. Yeah. Oh, I love it. So you can just walk into the urgent care unit.
You walk in.
Okay. That's great.
No appointment needed.
Okay.
Once you walk in, you're seen by the urgent care doctor to kind of get medical clearance.
Mm-hmm.
Then you talk to either a social worker or an MA. And then after that, you'll meet with one of us. Every patient is seen by a physician.
Okay. Interesting.
2 physicians, really.
Oh, wow. Okay. So we'll put all of the information of, if you're just, interested to learn more or interested to be seen, we'll link all of the information in the text under this episode, so you can research and find out more. But thank you for joining us
Yes, thank you for
again.
having me.
You'll have to come back and we'll chat about we could talk endlessly about all of these different issues, but you're doing just such amazing work, and thank you so much
Thank
for
you.
bringing these incredible resources to our families in our community.
Thank you so much.
Thank you. I'll see you soon.
Thank you.